So now we are going to continue with the pathogenesis of malnutrition. Now, for the pathogenesis of malnutrition, we need to know that the we are going to have five major groups of pathogenesis of malnutrition. One, either it is going to be that the child is not taking in food appropriately. That's one group of pathogenesis. Is it clear? The child is not taking in food appropriately, or the child is not absorbing the food appropriately. So that one is entering under protein energy intake. Is it clear? Protein energy intake. So in protein energy intake, the child is not taking food appropriately. Is it clear? Now, the second problem with the pathogenesis is a malabsorption problem. Malabsorption problem. So he's taking food, but he's malabsorbing. He's not absorbing it properly. So you have malabsorption disorders. Basically, and the malabsorption disorder are generally a result of the local infection of the gastrointestinal tract. So we have local gastrointestinal tract infection, like you can have malabsorption in cases of infection, mostly parasitic infections. Basically, and parasitic infection can be divided into either protozoan infection or worm infection. For protozoan infection, you have Giardia lamblia, which is involved as it causes malabsorption syndrome in children. And for the worm, we have worm infections, like in the cases of Ascaris lumbricoides, which is an example of a nematode, or we have other like cestodes, like Taenia solium or Taenia saginata, and we have also the last one, which are trematodes like Schistosoma mansoni. So those are the different things which are associated with that. The third group of pathogenesis, we are going to have chronic diseases. So if you have chronic diseases, example of chronic disease that the child can have from birth till adulthood, we have congenital heart disease. It's a chronic disease that the child can have. Is it clear? The next chronic disease that the child can have liver cirrhosis, which is biliary in origin. So we have a biliary cirrhosis. Is it clear? The child can have a chronic lung disease. Is it clear? A chronic lung disease. So a chronic lung disease like a bronchopulmonary dysplasia. Is it clear? The child can have particular disease, a chronic disease particularly occurring in cases of a chronic disease particularly occurring in Europeans. Is it clear? Generally in patients who are Caucasians. Is it clear? So when we are Caucasians, the disease here is going to be cystic fibrosis. So if you have chronic cystic fibrosis, can occur in these people. And lastly, we have malnutrition in chronic disease in patients usually who are living in sub-Saharan Africa in cases of sickle cell disease. So those are diseases that can prone for them to be malnourished. So those are chronic diseases from childhood. Apart from chronic diseases, is it clear? The fourth group that we are going to have, we have chronic infections. Is it clear? Or we just have infections. Let's just put it infections. Infection groups. Now, on the infection groups, we have two major infections. We can have acute infection or we have chronic infections. Is it clear? On the infection group, we have acute infection and we have chronic infection. Under the acute infection, we need to know that you can have gastroenteritis, bacterial gastroenteritis. Is it clear? Gastroenteritis can be a cause of malnutrition. If a child is vomiting for 1 to 2 weeks, that's an acute gastroenteritis, and that's making that the child is not absorbing the food. Is it clear? So gastroenteritis can be involved with that. The other element is now with we have other acute bacterial infections. Is it clear? A patient is kind of having pneumonia and then is having anorexia. So acute, generally it is on acute infection, you have acute bacterial infection. If a child has pneumonia and is having anorexia, he will not want to eat for 1 week. So he is going to have an acute malnutrition. So in this case, you just have acute bacterial infection, which can be acute pneumonia, acute gastroenteritis, acute urinary tract infection, so acute meningitis, all that which is going to prone to anorexia, and the child is not going to eat acutely. Is it clear? And then we have chronic infections. Chronic infections, particularly tuberculosis, and we have also HIV. Is it clear? It's going to result to that. The fifth major component, we have malignancy group. Is it clear? You have malignancy group. Under the malignancy group, it is also divided into acute malignancy, malignancy that occurred acutely with symptomatology, and we have malignancy that had gradual onset of symptoms. So chronic malignancies. Is it clear? Now we need to know that generally in children, their malignancies are going to be acute. The malignancies that are going to be acute are hematologic malignancies like lymphoma. Is it clear? Lymphoma, particularly Burkitt's lymphoma, is very acute in progression and is going to be very fast progressing. Is it clear? It's going to be a cause of the malignancy. Is it clear? So we are going to have fast progress. And I've also forgotten that in infection, we have particular infection, viral infection, acute viral infection also occurring, particularly that of measles, which is associated with malnutrition. So let's come back to malignancy. We said lymphoma is associated here. It's an acute malignancy. Is it clear? Now you have other chronic malignancy that can occur, which can take a period of time to occur. We have chronic lymphoblastic leukemia, but acute lymphoblastic leukemia is going to occur during an acute period of time. Is it called acute myeloblastic leukemia, ALL and AML are going to be more acute. Is it clear? But in the cases of chronic lymphoblastic leukemia, CLL, is it clear, or chronic myeloid leukemia, if it occur in children, it's going to occur in later on period of time. We have also nephroblastoma or renal tumor, which can be a cause of malnutrition and other forms of malnutrition. Is it clear? Now, generally, those are the pathogenesis of malnutrition. And this pathogenesis of malnutrition, those based on those 5 groups of malnutrition, we are going to have the pathogenesis divided into acute pathogenesis and we have chronic pathogenesis. Is it clear? So we are going to have the pathogenesis resulting to acute malnutrition and we have pathogenesis resulting chronic malnutrition. Is it clear? So we have the pathogenesis that with those 5 groups, we have the groups that are going to result to acute malnutrition, and we have the group that are going to result to chronic malnutrition. Is it clear? That acute malnutrition occurs less than 3 months, and chronic malnutrition occurs more than 3 months. So the first group of disorder, we have protein energy intake. So if a child suddenly stop taking in food, or they suddenly stop giving food to the child with maltreatment, is it clear? Protein energy intake, low protein energy intake is going to result to acute malnutrition. 2, you can have malabsorptions. The malabsorption problem that result to acute malnutrition are the malabsorption problems that are due to parasites, and you have also gastroenteritis. Is it clear? So gastroenteritis and parasitic malabsorption problems like with Giardia lamblia are the ones that are treated with acute malnutrition. So gastroenteritis and parasitic problems like Giardia lamblia are the ones that are treated with acute malnutrition. The third class of medication, we cannot have chronic diseases here. Is it clear? So the malignancy is also going to be involved here. We have infection first. And the infection associated here are acute infections. For the acute infection, you can have acute bacterial infections. Is it clear? Bacterial infection, systemic infection associated with like pneumonia, like urinary tract infection, like meningitis, where it's associated with anorexia. Or you have also acute viral infections. Is it clear? Acute viral infections like measles. Is it clear? Acute viral infection like measles, and measles is typically associated with malnutrition. Now, the fourth one, we have malignancies, and the malignancy here we have acute malignancies. acute malignancy associated with malnutrition. Is it clear? Particularly which malignancy? We are going to have lymphomas. Is it clear? Acute lymphomas. We have acute lymphoblastic leukemias and we have acute myeloblastic leukemias. Is it clear? All of them are inside acute malignancy. So all these are located inside acute disorders. Now, the next one is chronic disorders. So when you have chronic malnutrition, the first one that is first is still first group that is going to be present, still protein, energy, malnutrition. If the child has not been taking protein and energy, that's carbohydrate and protein, and carbohydrate and fat for a long period of time, more than 3 months, he's still going to have chronic malnutrition. The second one is that when you have we have also malabsorption problem, but the malabsorption problem here is going to be more associated with parasites like worms. Is it clear? You have also malabsorption disorders here, but the malabsorption disorder is more associated with parasites like worms. Is it clear? The third one is that we are going to have infections, but infections here are chronic infections. Is it clear? And this chronic infection can be due to bacteria, like in the case of mycoplasma tuberculosis, that's going to cause tuberculosis. And we have also chronic viral infection, like in the case of HIV. Is it clear? The fourth element are malignancies. Now, these malignancies now are more of chronic malignancy, like nephroblastoma, or other chronic malignancy like chronic myeloblastic leukemias or lymphoblastic leukemias. Is it clear? So those are all involved under the pathogenesis of acute pathogenesis of malnutrition, divided into acute and chronic pathogenesis. Thank you.